Dana. Good morning, everyone. Thank you for being here. As you know, we were going to give updates regularly on our public safety briefing, and today we want to talk about homelessness. The other thing I will say is that a couple of days ago, I reauthorized our state of emergency for another month. We've had the opportunity to use some of the great tools that the state of emergency provides us, and as we continue to work on violence, I want to make sure that we continue to do that. You know, I want folks to know, when many of you know I was very close to my father, and in 2018, when my father passed away at his funeral, some of the first people to meet me at the doors of the church were some of his clients. My father spent his life working with homeless individuals, and particularly homeless individuals that were affected by mental illness and drug addiction. So I grew up watching him go under bridges, go to some of the most dangerous places to help people transform their lives. And I was so touched. At his funeral, at his calling hours, some of the first people I met were individuals that he had helped, who had transformed their lives because he poured into them and did the hard work. Not on social media talking about what needed to be done, but taking responsibility and going, and he took that work seriously, and he did it for almost his entire life, working with those individuals. And that is a challenge that we have now in our community and across the country. The challenge of unhoused, homeless individuals in our city is a challenge across the country, and is something that we must focus on as we work to continue to build our city. And disproportionately, we are seeing this also be affected and going hand in hand with our opioid epidemic, which is out of control. So we will continue to share information about prevention, intervention, and suppression, but I want to talk about the homelessness situation today, and that is our topic of this morning. And you have all of my staff here. Chief Dave Smith. I'm joined by Chief Dave Smith. I'm joined by Sherman Dickerson, who is president of the Joseph Avenue Business Association. This area in the Northeast are seeing great challenges, and it's important that people who actually live and work in the neighborhood speak on this topic, so I'm glad to have him here today. The Commissioner of the Department of Recreation and Human Services, Dr. Shirley Green, Deputy Corporation Counsel, Patrick Beath, and Commissioner of Neighborhood and Business Development, Dana Miller. You know, of my 6 priorities, homelessness affects all of them: public safety, economic empowerment, and strengthening neighborhoods. Homelessness is a multi-topic issue that requires multi-targeted responses from multiple city departments. So these folks that are here today will help me elaborate on this. Each of these members of my senior management team will talk about the emphasis on some, but not all, of the things that we are working with as it relates to homelessness. But first, let's talk about what we're doing today. There are so many cases where homelessness now in Rochester has been out in the open. And many of that is directly tied to our opioid epidemic. Many individuals that do not live in these neighborhoods are coming to Rochester to access drugs, live in the open, and in many cases not getting the help that they need. And we're looking forward to continue this work to partner with our partners to even do this. One of the things that we just did, just in August, as you know, was that we have Peace Village, which is an encampment on the west side of the city. We put out $250,000 to PCHO, Person-Centered Housing Options, and the idea of that is that those individuals will be able to get intensive service. There are some individuals who don't want to go into facilities. But what we're saying is we want to make sure that we get those that are unhoused housed. And that means going to where they are to get them moved into a facility and get the treatment that they need. We as a city cannot sit back, and all of us plays a role in this, and you'll hear us talk about this. We cannot sit back and watch individuals with serious mental health, in many cases substance abuse issues, stay in our streets night after night. The wintertime is coming, and this is also why this is very important. This is a topic that we cannot ignore, and it's going to take a multi-pronged effort to be able to do this. We are going to be working very closely. We are working and we'll continue to work very closely with our county. The city doesn't run social services. We don't run social services. But the challenges that we are seeing affects the city more than it affects anywhere else. And it's not fair to the residents, and it's not fair to the people that are on those streets. And you'll hear from others on some of the things we're seeing. The last press conference I mentioned that we had individuals that were coming from suburban areas to buy drugs, and in many cases this has resulted in tragedies. We have had people die because they have come to the city to take part in drugs and live on the street. We cannot have that in our city, and we must change that. The other thing that we're doing is mapping the problems where we see them. Internally, we are tracking all of the locations where we have individuals that are unhoused, that are homeless. Because in order for you to be able to solve a problem, you have to know what you're dealing with. And I got into office and I asked, I said, where are these folks? Where do we know? Oh, they're here, they're there, we really don't know. That's unacceptable. So what I've said to my team, and they did this within a week, is I want to know every spot within the city of Rochester, every zip code in the city of Rochester where we have homeless individuals. We want to make sure we know where they are so we can make sure that they're getting the intensive services that they have. And we want to partner with organizations that are out there doing that, and we are doing that, and we will continue to. These individuals that are on the streets, it's dangerous for them, but it's also dangerous for the individuals that are in the neighborhood. Where you have had violence take place, where you have had individuals die, where you have had, in some cases, young people step on needles. These are things that we cannot tolerate in our city, and more importantly, is something that we have to make sure that we take care of. And that means continuing to work with Monroe County and all of our partners. The second thing that we're doing, and we'll continue to do, is that we are working with, we'll be working with a cohort of cities from across the country that are dealing with this issue, to share best practices, but more importantly, make sure that there is a comprehensive plan with the city of Rochester, coordinated with the county and others, to make sure that we have a comprehensive plan to address homelessness in the city of Rochester. We know that this is a countywide problem. We know that it knows no race, it knows no gender, it knows no boundaries. But within the city of Rochester, it is a problem that is disproportionately affecting us, even though residents are coming from all over the county. The other day, I heard someone say, oh, we're worried about crime coming into the city, coming from the city to the surrounding areas. Well, I wanted to call that individual and say, you're worried about that? Well, I'm worried about individuals coming in from the suburban areas, coming to buy drugs and fueling our drug problems in the city. So this goes both ways. And it's time for us to pull the cover off of that. We talk about the homicide rate, and our homicide rate is unacceptable. We are approaching 100 overdose deaths in Monroe County this year. And many of those are directly tied to individuals that are living on the streets because they have addiction. So you have addiction, homelessness, and mental health all mashed together, which is having a toxic combination in our community, and it's not safe for them. And for me, I'm not talking about this as somebody who's watching as a casual observer. I've seen this firsthand, walking the streets as mayor, and I saw it growing up and watching my father and my family deal with these situations. The third thing I want to announce is that many of you may have heard that we have gotten an opioid settlement. And the opioid settlement dollars that we have gotten will allow us to be able to be creative to address this issue. And you will hear in the coming weeks and months that we will be putting together a team to decide how we will use our opioid settlement dollars to address particularly opioids, the opioid epidemic, and the homelessness epidemic. And in too many instances, in this case, they go together hand in hand. And that's what we're seeing on the streets. So we want to make sure that we do that. As we know, this is a very complex issue. It's something that we must continue to work on. I'm going to now have the chief come up and make some comments about this, and then I'll come back and introduce our other brief speakers. Chief?
Thank you, Mayor. We at the Rochester Police Department are committed to doing our part to combat the humanitarian crisis known as homelessness in the city of Rochester. There are far too many people sleeping on sidewalks, sleeping in tents, sleeping in parking garages, sleeping in doorways. As winter is coming, we as a society need to come together and ensure that everyone in the community has a safe place to sleep. The Rochester Police Department is committed to utilizing an outreach model that is based upon addressing the root causes of homelessness. The root causes are primarily mental health disorders and substance abuse. We recognize that at times enforcement will be necessary, but the goal is to maximize the use of non-arrest solutions, as we've done in the past, to not only help those in need, but also ensure the safety of our city's residents and our city's guests, I might add, who come into the city for legitimate purposes, such as our festivals. In the past several weeks, we've undertaken several initiatives to provide service to our homeless population. In our central section, commanded by Captain Gabe Person, who's here with us today, we've begun a bi-weekly program utilizing personnel from our Community Affairs Bureau and our Crisis Intervention Team to provide services to the homeless in our downtown area. This program consists of members of the RPD teaming with mental health, addiction, housing, veteran, and faith-based specialists. The goal is to provide street-level intervention attacking the root causes of an individual's homelessness and to facilitate getting them into suitable housing, while simultaneously getting them treatment for their underlying conditions. This program began last week, and on the first day alone, made contact and provided service to nearly 50 people. That's 50 on one day. Just yesterday, the detail provided services to 12 homeless individuals, including 3 who did take advantage of the housing opportunities that we offered. Beyond downtown, we're also focused on outreach efforts to a plot on city property that the mayor's, I'm sure you've heard the mayor speak about, Loomis Street off Joseph Avenue. Not only is this property the site of a homelessness encampment, it is also the site of an open-air drug market and the subject of recent violence. As the cold weather of winter sets in, it is our priority to ensure the safety of those living along Loomis Street. We began our outreach on Loomis Street at the end of September, when a team of Rochester police officers from the Crisis Intervention Team, alongside a multitude of our community partners, responded to the encampment and offered a number of resources to the residents there. We found the location to be dangerous and unsanitary, and as a result of these conditions, we called our partners in the Department of Environmental Services, who assisted in cleaning up dozens of used and discarded needles. They secured several abandoned structures and removed hundreds of pounds of garbage from the site. As we move forward into winter, we plan to continue our outreach efforts in both downtown and Loomis Street, as well as look to expand these services to other areas of the city. We will continue to do our part to keep the residents of our city safe. Thanks.
Thank you, Chief. I now want to have briefly our Deputy Corporation Counsel, Patrick Beath, say a few words. Patrick.
Thank you, Mayor. Good morning, everybody. The Mayor spoke about how our homelessness problem is not just a city problem. It's a regional problem. Folks are coming in from outside the city to the city. They're coming to open-air drug markets, and they become homeless and become a city problem. The Law Department is working with RPD to combat this by doing outreach to those folks who are coming to these open-air drug markets. When we see cars pull up to these open-air markets, and we see folks in those cars interacting with the people at these markets, we're going to take note of those cars, and a letter is going to be sent to the car owner. It's going to come in a bright pink envelope, and it's going to inform the owner that that car was seen at a drug market. Folks in that car were seen interacting with the people at the drug market. And it's going to warn them that this is dangerous, and it's going to offer them help. If they're struggling with addiction, It's going to refer them to a number of service providers so that folks can get the help they need and the city can address the problem before it becomes a problem. The law department is also working with the RPD and with other folks in city government, across city government, the neighborhood service centers, the fire department, the zoning department, to identify locations where illegal activity is going on and to address those. We're meeting monthly to find these locations and using a variety of enforcement means to tackle those, including, as the mayor said, the emergency order, the gun violence emergency order, which we've already used to shut down a couple of locations that were attracting groups of people that became violent and where shootings took place, and where we couldn't get cooperation from the owners. We used that emergency order to shut the places down. And with that, I'll turn it back to the mayor.
Thank you, Patrick. Now I'd like to have Commissioner Dana Miller come and say a few words about some of the services that we offer and partnerships that we have. The one thing I want to say is that I never thought that this would be the city needing to get so involved in this area, but it affects us, and I don't sit on the sidelines, so we got to be proactive. So Dana, please come forward.
Thank you, Mayor, and good morning, everyone. As the mayor stated very clearly, the model that we use in dealing with this challenge is a model that is called Housing First. And the point of this is that people may have many challenges, whether it's drugs or addiction or poverty, but until they can be housed somewhere, it's very difficult to then move the next step into helping them recover. So we really focus on housing first, which is really compassionate response and focus on safety and care for both those involved and the neighborhoods that are impacted. So we partner with Person-Centered Housing Options, or PCHO, and the Monroe County Collaborative to help identify housing options that meet individuals where they are. We also pay for street outreach at Peace Village, which is, as the mayor stated, an opportunity for people who really would be better off living outdoors to have that opportunity. And we also work with individuals in other areas where the homeless may gather. And typically, whenever we're doing this outreach, it's an outreach that's supported by the county's Office of Mental Health, the Center for Youth, Youth for Christ, and St. Mary's Church. But the whole idea is to make sure that individuals are given the opportunity to receive services that will ultimately get them off the street and into a safe location, whether that location is a shelter or permanent housing. But in many cases, this outreach may take months for folks before an individual accepts services. Many times, because of some of the challenges they're going through, there's a matter of time that it takes to build enough trust in the people who are reaching out to them to have them then be willing to accept those services. So our intent is housing first, but in some cases people need to go into a shelter before they can go into more permanent housing. In our annual housing request for proposals, we prioritize projects that provide permanent housing to individuals who have been formerly homeless. And we're always looking for ways to create quality housing opportunities. And as an example, the Open Door Mission at the end of September opened a 24-unit complex that was built in the renovated Miller building on Main Street next to their main headquarters. I was there for the ribbon cutting. I toured these apartments. They're absolutely stunning inside, fully furnished, and these are now made available for homeless individuals who are ready for housing. We also spend a significant amount of funding that comes from the federal government through the Community Development Block Grant Program, or CDBG as it typically is called. Some of that funding comes through a program called Emergency Solutions Grant, and that's how we help pay for these outreach services that we provide. Last year we received about $700,000 in Emergency Solution Grant funds, and those funds are used to help us do this outreach. And we also fund emergency shelters that are used to provide emergency housing to individuals. So we have a very robust set of services that we provide to try and get people first into housing and then beyond that into a situation where they are much more stable. I have two members of my team here who work very, very hard every day on that. Carol Wheeler, who's the manager of housing, and John Oster, who handles the primarily most of these projects. And if we have any detailed questions, we may ask them to join us. But those are the kinds of things that we're doing. They're all very challenging but very critical. Thank you.
Thank you, Dana. Commissioner Green, as you know, Commissioner Green runs our Department of Recreation and Human Services, where we house our PIC team, person in crisis team. We have increased the number of individuals that are in that team, and they play a role in helping us to combat this problem of homelessness. Dr. Green.
Thank you, Mayor. As the Mayor talked about, the issue of homelessness and opioid addiction. What's important to note is that we have resources for the residents. As the Mayor talked about, within our Department of Human Services, we have what we call a crisis intervention unit. We have the person in crisis team, which can be dispatched by either calling 211 or 911. So when a person is in crisis, they need someone immediately to work with them, and that's part of our PIC team. We also have our community support team, and this is a place where you can actually call and have counselors work with residents who need the help. We refer, we work closely with our Department of Office of Human, the Department of Health over in Monroe County, and so together we partner to provide the services. We have to be where the people are. Our PIC team is out in the neighborhood regularly. You heard about Peace Village. Our PIC team visits Peace Village. What's important is to build relationship with the residents so that they build trust, and when we're offering those services, they believe that we're there to support them. If you know someone who's in crisis, we encourage residents to call our community support team at 428-6630, and you can get support immediately. We work evening hours as well as on Saturdays for community support, but PIC is 24 hours a day, 7 days a week. PIC is always available to come and help the residents. When you need help, we need you to call, and we will be there. And PIC continues to be in the community to help residents, to build the relationships with folks who are homeless and folks who are dealing with opioid addiction, because you need trusted members of the community to work with you, and that's what we provide in the Crisis Intervention Unit. Thank you.
Thank you, Dr. Green. Lastly, I want to have just briefly, and I have to, and we're going to do this briefly because I have a speech that I have to give in a couple of minutes. I'm going to have Mr. Dickerson give just a brief, say a brief set of words on how this is affecting the area of Joseph Avenue, Clinton Avenue, all that's happening there, because often we don't hear from the residents. And see, my office, we hear from the residents. They call my office. They don't, you know, they're not out loud and all those things. They call us to let us know what their challenges are. And no one can speak better to it than the people who actually live, own businesses, and work there. And I want to have Mr. Dickinson Sherman say just a couple of words on the effect of this homelessness, but really the opioid epidemic that we're seeing, particularly in Northeast Rochester. And it's not really Northeast Rochester residents, it's some of them, but most of those folks have come there, and they don't live in the neighborhood. And they're having an effect on my city, on our city. And I want Sherman to just say a few words about the effect that it's having on the neighborhood. I know that they called us for help as a city, and we're going to respond for sure, but I want to have Sherman to say a few words.
Thank you, Mayor. Good morning, everybody. I'm here to speak on the impact that this is having on this particular area. I'm the president of the Joseph Avenue Business Association, been the president for the past 10 years. I've seen the transformation that has taken place. This problem is an enormous problem. You have homeowners that's in the neighborhood. The encampment, these homeless people, and they're just pooping on the people's lawn. Needles are everywhere. and it's just disproportionately getting out of control. If this problem existed in Fairport, Penfield, Webster, or one of those nice subdivisions, it would have been over in 24 hours. It would have never gotten to this point. Kids walking down the street, finding needles, stepping on needles. It's private property. The Joseph Avenue Arts and Cultural Alliance owns the old synagogue where all of this is taking place at. They're paying people on a daily basis to come clean up needles, human feces, and we shouldn't have to, our kids shouldn't have to be subjected to this. The city is doing everything they did. The mayor's team has just laid out what they're doing. So I don't understand why the finger point is pointing at the city when they're doing everything they can to provide resources to get these people some type of help that they need to get off drugs and get whatever mental problems or issues that they're having. I'm all for improving the quality and better life of people, but not at the hands of my life and the quality of my children and the people around me. Our lives are diminishing. What you guys see on the news every day, I live it. I live in the worst zip code in Rochester, 14605. I've been there all 58 years of my life. So everything that you see on the news, I've navigated every day. So I want this out of my community, and I'm just here to do my part, and the city is here to do their part, and we need the community to come together and do their part. Thank you.
Thank you. Thank you. And I could not have said that more better. So I want to thank you all for being here today. We will continue to do this. The other thing I wanted to mention is that I want to encourage the community to also support. We have a little bit of a panhandling problem in many of these areas, and people are using that to support their addictions. I want to encourage our folks, if you want to help with this problem, Trillium, PCHO, Catholic Charities, Center for Youth, Veterans Outreach, these are all organizations that you can work on supporting to help with this problem. So I would urge people to volunteer, turn to those organizations, donate to those organizations to help stop this problem that we are seeing. I only have time for about 1.5 questions because I have to go speak and I am late. Anybody have a question? Yes.
So a lot of these out-of-town buyers coming in from out of town, are you working with local suburbs or places outside of this area to kind of coordinate cleanup effort, aid effort, law enforcement?
That's a great question, and I believe that we will absolutely, as we continue to get data on where a lot of these folks are coming from, that we will work with those surrounding towns, suburbs, and villages where these individuals are coming from. We're one community. We're all from Monroe County, but the challenge is that the northeast section of the city, particularly 14605, are dealing with the disproportionate number of individuals that are coming from outside and being engaged in drugs that often leads to homelessness. And often, I convened a group yesterday. Why this happens is because if you live in Penfield or if you live in Perryton, it's a smaller town, so everyone kind of knows everyone. You can come to the city and you can be anonymous. Come with your book bag, set up camp, set up a tent, and you can be anonymous. And we need to work with those surrounding counties to make sure that they can help us solve this problem. This cannot be just an issue that the city is dealing with alone. I'll take one more question. Absolutely. I'm absolutely certain that the county has enough treatment beds. The challenge is getting individuals into those beds. Can it always be expanded? Absolutely. I do think, though, and this is a whole different conversation, that as it relates to mental health, that needs to be something that we have to have conversations with at the state level and other levels of government to expand the number of beds as it relates to mental health treatment. Because too often in this community, individuals have a mental health episode, you have the providers, you have the PIC team and other people provide those services to those individuals on site, they go into a hospital, and then there's not space, they don't get the mental health treatment that they need, and then they're back out on the streets and homeless again, added with the mental health issue, and then added in an addiction issue, a substance abuse, substance use disorder issue, and that exacerbates the problem. And we will work to change that. This is not only a problem for Rochester, it's a problem for the larger community, but more importantly, it's a problem for humanity. People deserve to not live on the streets. And I need everyone in this community to say that we are not going to tolerate anyone living on the streets, period. And we have to work hard to make sure that we don't do that. Thank you very much, and thank you all for being here today. Thank you.